Hello, welcome to today's conversation with PsychU Supporter American Association of Suicidology. Dr. Rachel Self here from the Otsuka Neuroscience Medical Affairs team, joined with Colleen Creighton, the Executive Director of AAS. Today's interview is sponsored by OPDC and Lumbeck, committed supporters of the mental health treatment community. On behalf of our community, I would like to welcome you, Ms. Creighton.
Thank you. Thank you for having me.
It's our pleasure. We would really like to get started here by you telling our listeners a little bit about the American Association of Suicidology.
Sure. So the American Association of Suicidology was founded in 1968, and it's really this hybrid of all these different entities united around suicide prevention. So we're divided into 7 different divisions. You have everything from students to clinicians to researchers, prevention, crisis centers, loss survivors, and lived experience. So it's really kind of anybody impacted or touched by suicide or suicide prevention in any format.
That's fantastic, and we probably really need all hands on deck given the current state of the science regarding suicide. Could you share with our listeners, just to get them up to speed, about some of the recent statistics around suicide awareness and prevention?
I think when many people think about this issue, they know someone or they've been touched by suicide, but you don't realize the full impact. So nationwide, more than 47,000 lives are lost each year to suicide. When you break that down and you realize that's 129 individuals that take their own life each day, it's clearly necessary. We need to change something. We need to do something different.
And in light of this, are there any special initiatives that you would like to share with our listeners about AAS and what they're doing this year?
Absolutely. Being membership-based, it provides AAS a really good glimpse into where we could play a greater role. So what you're starting to see come out of this conference, the association this year, would be the fact that law enforcement is getting more involved. So we're doing a lot more on giving them the tools they need. Crisis centers, so we're working a lot more in making the public aware of the valuable role that crisis centers play in every community out there. We're letting people know to the youth. We're working a lot more with the younger middle school and high school to really help us work with what their needs are and what kind of tools we can provide to them.
That's so important. We hear so often you have to meet people where they're at, correct? Mm-hmm. So in line with some of those initiatives, is there anything specific to this year's theme or the conference or different strategies to raise suicide awareness that AAS is engaged in?
And if you look at our theme this year, absolutely, it's taking all these different variables, all these different populations, all these different demographics, and it's converging them and getting them to talk in the same room and address the issue from all their different perspectives. I think one of the things that we're up against with this field is in the past it's been very siloed. Everybody stays in their own box, and we're trying to amplify that message out to more people and say we have to stop talking to each other and we have to really start talking to one another and kind of amplifying that message out of this field into everybody and to make it reduce stigma and make it a conversation that more people are having on a daily basis.
So with that, opening up the dialogue, are you seeing specific progress regarding some of the statistics we just talked about?
We are. So we're seeing that across the board, I think people feel more comfortable knowing that they can talk about suicide. And what we're seeing across the board is that a lot of people now realize that if a friend is in need, they know where to turn, they know how to get them help. And so I think across the board, encouraging more conversation and dialogue is where we're seeing everyone headed as a whole.
In terms of the dialogue, could you suggest anything specifically for healthcare providers, specific organizations or payers in ways that they can get more involved in that dialogue or some of these initiatives and help tackle some of these suicide problems?
And I think one of the key things that can be done, in which you are doing a phenomenal job at, is really bringing in all of these different voices to the same table and saying it's not just the healthcare industry, but these healthcare industry folks are in communities, and who else is in the communities? It's all these different factors, all these different professions, all these different demographics. It's really getting everyone to the table at once, having the conversation to create this unique balance of what model works well for our community. Because as we see across the board in suicide prevention, one model does not fit every single need out there. So I love what you guys are doing and bringing everybody to the table, addressing the need, and then formulating a response that's really unique to your specific needs.
Thank you so much. Would you share with us why AAS decided to stand with PsychU as a supporting organization?
Absolutely. I think what you are doing is phenomenal in that you're addressing it. You weren't afraid to step up and say, we need to address this. So first of all, you recognized that it was an issue, and then you took the lead in stepping out first and really saying, what do we need to do? Getting the groups together, facilitating the conversations, even just listening on the ground to the conversations that were already taking place and seeing how you could fit a need. So I think we're appreciative that you addressed this. You wanted to, but you also came with a very thoughtful approach at the same time.
And we are also very inspired by all the work that the American Association of Suicidology is doing. So we thank you so much for all of your dedication, day in and day out. And thank you for your time. I know this is a very busy meeting, and your time is in great demand. So I appreciate you being able to step away and speak to our audience a little bit about the American Association of Suicidology and some of the suicide awareness and prevention strategies that are getting incorporated throughout the year and throughout the time span that you guys have been in existence. So for our listeners out there, we do encourage you to get more quality mental health content about this topic and others across all of our platforms on PsychU. Healthcare professionals and advocates can register for our website for free at psychu.org and gain access to a vast library of news, trends, perspectives, and presentations. We also encourage all of our listeners to subscribe to our Google Play, iTunes, or YouTube channel for more great multimedia content. And of course, you can tap into us on social media through LinkedIn or Twitter via our handle @PsychU Community. Thank you so much for joining us today, and thank you again so much, Ms. Creighton, for your time.
Thank you.